of people to today's widely diversified medical experts with a wide access to complex technologies that extend far beyond a timber cast for stabilizing broken joints. Say, accidents are bound to happen, and in the accidents, people used to break their bones. So, timber casting was one of the early methods by supporting the broken bones and then tying them onto some kind of piece of timber. That used to be the kind of treatment. From that, today's technology, which is related to curing various kinds of bone-related issues or various other kinds of, say, treatments which are given. So this essentially has really evolved. Today's healthcare systems, the medical professionals employ technologies and instruments that frequently have been proposed, devised, and manufactured by non-medical professionals. Basically, this is very important to understand that the human civilization has evolved through several centuries, and these different centuries, they have seen development of different practices, different kinds of technologies, including the technologies related to manufacturing. Say, industry 1.0 was the kind of manufacturing technology which was related to use of some kind of human labor and animal power. Industry 2.0 was related to automation based on steam engine. Industry 3.0 was related to automation related to electronics, electrical and computer technologies. And essentially now we are a part of the Industry 4.0 revolution, where it is said to be based on the Internet of Things and the sensor technologies and the communication and the technologies which are related to the Internet domain. So these kinds of things, they are developed simultaneously, and they are used not only just in the medical field, but in various other attributes of our life. Out of them, medical domain is of course very much benefited because the technologies have evolved. Say, for example, the simplest device that is used in the medical domain is a thermometer. And early thermometers, they were based on mercury, expansion of mercury, and mercury thermometers, they were very common. These days, of course, these are replaced by digital thermometers, and these digital thermometers, they are serving a big role. Similarly, the stethoscopes, they are also very common tool used by the medical professionals. And these all devices, these and many other devices, these are essentially manufactured, developed by non-medical professionals. They of course had the instruction, or they had the kind of inception from the medical professionals, but the non-medical professionals, that is the engineers, the scientists, the material scientists, they all essentially contributed in the development of these medical instruments. To that extent, medical physicists in particular play a key role in supporting medical professionals and subsequently in helping patients. Various physicists, physics is a branch which is dealing with a variety of things related to, say, kinematics, related to mechanics, related to optics, related to electromagnetics. So these all different things, they essentially contribute in developing some kind of phenomena, and which subsequently lead to development of different types of devices. So this is somehow the physicists, they are helping the medical professionals. Today, medicine, through its numerous disciplines and disciples who engage in all stages of patient management, from disease prediction through screening, diagnosing, phenotyping, therapeutic interventions, follow-up and post-intervention, or palliative care. So these are all different kinds of disciplines. These are not limited, of course, there are many more one can add. So these are all different stages, they are essentially taken care by the medical professionals, and they are helped by the various instruments and facilities which are there. This is diversified in a way that it can no longer be represented by a single medicinal man, as it was fathomable few hundred years ago. So a few hundreds of years ago, there used to be a few persons who had some knowledge about the treatment, some knowledge about the diagnosis, and people used to believe on them. These days, we find that it is not that single person kind of based mechanism. Even if you approach a doctor, the doctor will essentially do the preliminary analysis, but subsequently he will seek the help of various other professionals. There will be several tests which will be carried out. There will be several instruments which will be utilized in diagnosing as well as in the proper care subsequently and the treatment or therapy. So you have these different kinds of disciplines which are basically being developed further. There are a number of complementary disciplines which have evolved over the years. Over the decades, we have witnessed the pace of evolution in medicine together with its technical and methodological complements. Next to medical physics, these complementary disciplines include social sciences, ethics, chemistry, biology, to name a few. In fact, these days we find that the various stages in the medical, say, examination or treatment or post-treatment care, these are all different things. They are not just based on one single disciplines. There are multiple disciplines which involved in it. Say, for example, we have all now witnessed last couple of years the pandemic, and there were several kinds of cases in the initial phase. Subsequently, with constant efforts, people could come out with definitive plans of identifying and treating the patients. But again, we are going through a phase where there are post-pandemic or post-corona COVID complications, how to deal with them, how to handle them. Again, there is a lot of effort that is being done. And this is happening not only through the COVID, but various other kinds of ailments which we have witnessed over last several centuries. So these are all different things. They have these aspects. And therefore, there are, say, social sciences, ethics, they come into play. Apart from that, the actual treating, say, drugs or medicines, they are evolved out of the chemistry and the biology. So these essentially come and work together. All of them engage people and teams who seek to contribute visibly and some responsibility to social healthcare endeavors. Physicists and imaging scientists play a significant role of applied medical physics and medical imaging in particular. This is important to understand that among all, there is a very big role played by the physicists and imaging scientists. We understand that physics is the most fundamental physical science. Physics has contributed in almost all scientific streams, but it has contributed significantly to the health science very much. In this age of multidisciplinary collaboration, the physics professionals will have to have a synergistic relation with the experts of other fields to face the ever-growing challenges of modern health science. Physics provides explanation to every physical phenomenon. If you look at the human body and its components, they can be viewed and measured and altered as any physical objects. So we realize that the human body comprises of several systems. We have the respiratory system, through which essentially the air is inhaled and then it is again exhaled. The composition of the incoming air has more of oxygen concentration. The outgoing air has got more of carbon dioxide concentration which is thrown out by the body. So these are flowing in and out. There are lungs which take care of, inhaling the gases from the air, from the atmosphere. And there is a very specific science of flow or managing this fluid from in and out. So essentially we realize that the gaseous flow is very significantly handled by the lungs and the respiratory system. Similarly, we have another system which is the cardiovascular system, which is operated by the biopotentials, and the biopotentials are responsible for generating contractions and dilation of the heart, which in turn pumps the blood, the fluid in and out, and through a network of veins, arteries. So essentially through that the blood reaches to every significant part of the body, and again it is pumped back and the circulation continues. So this is a cardiovascular system. Now this cardiovascular system again is comprising of the vessels, blood vessels, which are flexible muscles, and these flexible muscles, they are again, one can see that they can be related to various material properties. Their properties, they are very important to know. We say that whenever the blood vessels become hard, the walls become thick, the blood pressure of the person increases. So blood pressure of the person is related to the properties of the muscles of which that particular tissues of which the blood vessels are made. Now this relationship is appropriately required to be measured. So it is seen that it is viewing of that particular object, measuring certain parameters and causing some alterations, maybe making some changes because of the treatment. Maybe there is some biological treatment, there is some chemical treatment. So these are all different things which are done, and whether the treatment has resulted into appropriate action which is required for the healthcare, that essentially is done by the viewing and monitoring measurements. If we look at the process of living animals more closely, we see many physical phenomena like circulation of blood, blood pressure, maintenance of temperature of the body, oscillation, which is related to the sounds made by internal organs. And through these sounds, actually, the stethoscope is used by the doctors for the purpose of diagnosis of various things which are happening inside the body. So this is basically for looking at the sounds made by internal organs. Over a period of time, many physicists enriched the subject with many experimental techniques to verify various theories. Many of the greatest inventions in modern medicine were possible only by importing techniques developed during experimentation in physics labs. Some of these techniques have revolutionized healthcare technologies for imaging the human body and treating the dreaded diseases like cancer. Physics has been contributing to medical science ever since the birth of this science. Some physical agents such as sound, heat, pressure, and light have been used to diagnose and treat diseases. Clinical thermometer, stethoscope, sphygmometer are the instruments based on the principles of physics. These have been the indispensable tools in healthcare domain for centuries. Many of the techniques used for examining the eye and treating ocular diseases take advantage of properties of light. The 19th century witnessed the development of a lot of physics-based medical technologies. During this century, scientists developed a purely mechanistic approach to physiology that led to the development of new healthcare specialists like electrophysiology, the study of electrical properties of biological cells and tissues; biomechanics, the study of the structure and function of biological systems such as humans, animals, plants, organs, and the cells by means of the methods of mechanics; ophthalmology, the study that deals with anatomy and physiology and diseases of eye. Towards the end of 19th century, the discovery of X-rays and radioactivity, these were almost contemporary actually. They brought a revolutionary radiation-based diagnosis and treatment. Soon after these discoveries, X-rays and radium were put to the therapeutic use as well. This gave birth to a new subject called radiology and medical physics. Physicists practicing medical physics are called medical physicists. The medical physicist is employed in hospitals, as they are very much part of the hospital organization. They are required to be present there, and they contribute significantly in the healthcare sector. They are concerned mainly with the medical application of radiation, diagnostic imaging, clinical measurement of radiation, and radiological protection. There are different tools and techniques based on this. Similarly, we have laser therapy. The term laser stands for light amplification by stimulated emission of radiation. This is naturally light, which is an electromagnetic wave. Really speaking, the technique was developed for war. Some physicists found its application in healthcare also. A laser can deliver concentrated energy in the form of finely controllable light beams. Clinicians can use them to perform surgeries which involve less pain and scarring, less blood loss, and shorter operation time. A laser is often used for corneal eye surgery to improve vision, removing kidney stones, removing tumors, and skin surgery. So these are very commonly used these days. In fact, laser assisted surgeries, they are very common, and in fact they are said to be having most of the advantages, especially related to the pain, scars, blood loss, and time of recovery. So these essentially they are helped by the laser. Similarly, we have the radiotherapy or radiation therapy, which is used for treatment of very deadly disease like cancer, and radiation therapy has emerged as most effective therapy for the cancer. Soon after discovery of radioactivity, the radiation sources like radium were put inside the body cavity near the deceased part. This type of cancer therapy is called as brachytherapy. The discovery of artificial radioactivity produced radioisotopes like cobalt-60 and cesium-137, which are used in radiation therapy. In developing countries like ours, cobalt-60 therapy machines are in vogue to treat cancer, whereas in developed countries, the field of radiation therapy revolutionized after the advent of linear accelerator. It is sophisticated high-energy machine that can deliver a beam of energetic X-ray or electrons to treat malignant tumor of cancer. Advanced cancer treatment techniques like 3D CRD, 3D conformal radiation therapy, and EMRT, intensity modulated radiation therapy, are possible on these machines. Linear accelerators, they are essentially the electron accelerators. So there is an electron gun, electron source, and subsequent to the electron source, there are say graded potential electrodes. They accelerate the electrons, and high energy electron beams are produced at the end. There is electron optics that is also used in these. The electron optics focuses the electron beams, and finally the high energetic beams, they can directly be used or they can be used to produce X-rays, and intense X-rays, they can be used for the purpose of treatment. Now we also have the application of these radiation sources in the medical imaging. Imaging provides a means to view the human body from outside and inside to probe anatomical, functional, and even molecular and signaling pathways non-invasively of the state of the patient for rendering an accurate and personal diagnosis. Essentially, if we just consider a very simple case of broken bone, now if you want to know whether the particular bone has been broken and to what extent, at what position, then this naturally cannot be done by manual examination from outside. If from outside we can have some kind of guess, but if we actually image using the X-rays, the X-ray images, they give exact location, the extent, and the provide guidelines for the further treatment. So this is very important. Medical imaging by means of radiology and molecular imaging has become a foundation of diagnosis and therapy planning in numerous diseases. Even the tumors which are occurring in the human body at different locations, these tumors, at times they could be simple agglomerations of tissues, but at times they could be malignant tumors, and they require to be diagnosed and treated as cancers. So these kinds of analysis of the tumors, that is very well done by the medical imaging. Imaging is used extensively in healthy subjects or volunteers. Yes, this is essentially methodology that is adopted, that on the healthy subjects or volunteers, it is used, and it is generating knowledge base related to the physiology and signaling, so as to build reference models of normal persons and functional correlates that can be employed to better define abnormal variants during diagnostics and therapeutic work of the patients. Essentially, this is a very understandable thing, that if we have an image of a normal person who doesn't have any ailment, and if we take the image of a person who has got some kind of deformity because of the, say, breaking of the bones, or because of the agglomeration of the tissues, or formation of the tumor, etc. So these two images, they can be compared, and one can say that, okay, for the normal person it is like this, and for the abnormality it is like this. So one can really go for proper diagnosis and then treatment. While treatment also is proceeding, whether it is going on in the correct line, that again can be diagnosed with the help of the images. Of interest, the 7 most frequently used medical imaging techniques nowadays are based on X-ray, which is conventional radiography. So we have the X-ray plates which are kept. Means in fact that used to be the old technique these days. There used to be X-ray films, and on the films the X-rays used to be there, the images used to be there, and one can essentially make use of those for various diagnostic purpose. But we now have the X-ray images directly digitized. So we have the digital sensors which are facing, and one can get a digital image directly on screen, and using that digital image, the diagnosis can be done much faster and in much sophisticated way. In addition to that, there are things like computerized tomography, positron emission tomography, PET, SPECT, optical imaging, ultrasonography, and MRI. The first two, the X-ray and CT, make use of high energy photons, that is the X-rays, to produce 2D or 3D image sets of the anatomy of living organisms. In contrast, nuclear medicine techniques such as PET and SPECT employ small amounts of radioactivity labeled tracers. That is basically, say, the positron emission tomography makes use of oxygen 16 as oxygen 15 rather, as the radioisotope, and this oxygen is injected in the human body. As we know that the human tissues, they have the metabolism such that they absorb the oxygen. So this oxygen, which is a radioactive oxygen, this will get absorbed over there, and from there, where the accumulation of the oxygen is more, that can be easily diagnosed. So when certain parts are essentially demanding more oxygen, or certain parts are, say, not at all reaching the oxygen, that can be very easily diagnosed by the technique. That is what the positron emission tomography is. So essentially, one identifies the flow of oxygen and where the oxygen reaches and where it is more concentrated, where it is less concentrated, etc., because of the radioactive tracers. Similarly, one can find out the metabolic and signaling pathways in the organisms, whereby their distribution and quantities can be measured through the emitted radiation. Finally, the MRI, optical imaging, and ultrasonography employ non-ionizing radiations for diagnostic purpose. Say the difference between the ionizing radiations, that is the high energy radiations, the X-rays or the radioisotopes, these are the ionizing radiations which create some kind of disturbance in the material. So this disturbance in the material where the electrons are released, ions are created, that may sometimes, if there is an overdose of that, then that may sometimes cause some kind of damage to the tissues. Whereas non-ionizing radiations, they do not cause any damage to the tissues because they are interacting only with the periphery and not actually trying to disturb the tissues themselves. MRI or optical imaging or ultrasonography, they are of such kind. So of the various imaging techniques, the X-ray based imaging techniques, they have some kind of protocol to be followed. They are little bit having some kind of safety issues and safety protocols they have to be followed. The doses have to be limited, and one has to be careful dealing with those. There are various kinds of directives which are given by the radiographers or the radiophysicists, and we have to follow all of them. But for the purpose of MRI or sonography, no such kind of need is there because they are non-ionizing radiations. These are the simply mechanical waves. Say ultrasonography is simply a mechanical wave in the megahertz range, or light waves for the optical inspection, optical imaging, and magnetic fields, which are for the MRI. So these interacting with the human tissues, they can provide various kinds of diagnostic signals, and one can analyze that. In general, most of the imaging techniques listed above, they can also be theoretical approaches using electromagnetic radiations in a wide range of frequencies of energies. These parameters partly determine penetration depth, spatial resolution, specific absorption rates, etc. In turn, this affects sensitivity and specificity of the medical imaging techniques applied. So we have these, as we said, X-rays and CT. They are the transmission images, and these are essentially based on the absorption of X-rays in different tissues. This helps generate images upon repeated scanning, can be used to sample dynamic processes, that is fluoroscopy, as well as 3D and 4D computerized tomography. Transmitted signals from a narrow X-ray beam traversing the subject are used for image reconstruction to form planar X-rays and cross-sectional CT images of the subject under investigation. CT is a tomographic imaging method with system that comprises of 100 or more detector rows covering an axial field of view of several centimeters. CT generates contiguous axial images of sub-millimeter resolution, which can be digitally stacked to form the three-dimensional high-resolution images of the investigated area. The preferred acquisition mode today is spiral scan mode. Nuclear medicine in physics, nuclear medicine physics and treatment. Nuclear medicine is based on the use of radioactive isotopes as probes to track physiological processes or to deliver therapeutic doses to specific targets. So where the radiation sources, they actually get imposed on the malignant tissues, and these tissues, they are destroyed because of the radioactive exposure. The measurement of the emitted radiation arising from the decay of the radioisotopes, it for the imaging or dosimetry is one of the fundamental skills of an imaging physicist. The physicists have been and are integral part in the conception, development, and improvement of the detection systems. The correction for the methods for various effects, limiting quantitative and qualitative readings, and in development and reconstruction algorithm for the tomographic applications. These are the contributions from the physics side. Ultrasound is ultrasonic waves, mechanical waves, and these waves from the transducer, ultrasonic transducer, they are made to incident on the specific part of the human body, and they penetrate to some level, they get absorbed, and imaging is done. Ultrasonographic techniques are used primarily for the abdominal organs, study of the abdominal organs, but at times, say, the ultrasonography is also used for the heart studies, especially related to 2D echo electrocardiograms. So these are essentially the techniques which are used using the ultrasonography. We have the optical imaging, even with the lasers and LEDs, they can be used for various applications. Many applications of imaging are targeted cultured cells or fixed samples, fixed cell samples. For instance, optical microscopy is one of the methods of choice, not only in histopathology, but also for studying cell development and cell fate, for genetic expression analysis. These are essentially the clinical kind of analysis, diagnostic tools, and they provide substantial insight into what is happening. So especially if you just look at any kind of body fluids, and these body fluids, they are to be analyzed, whether there are RBCs, whether there are WBCs, whether there are other components of the blood or various other fluids of the body, then one can essentially use such kind of optical microscopy. And even the genetic expression, gene mapping, or these days we talk about essentially the sequencing for the purpose of identifying the mutations of the genes. So these are all different things. They are essentially possible with the help of optical imaging. Routine medical application of optical imaging target surfaces and transparent parts of the human body. For example, dermatology, ophthalmology, various endoscopic procedures, and dentistry. So these are the commonly known things. Say, for example, the endoscopy is used for the purpose of seeing physically what is the kind of ailment inside the digestive tract. So through the digestive tract, esophagus, we have the tube inserted, and there is a camera which is carried. So that camera keeps on acquiring pictures and showing them to the doctor, so that doctor exactly knows whether there is any kind of swallowing, or whether there is any kind of lesions, whether there is some ulcer or some kind of bleeding happening. So these are all different things. They can be visually inspected with the help of the endoscopy. Ophthalmology, of course, is related with the images which are generated by the eye, and various diseases which are related to eye, they can be diagnosed. Dermatology is naturally related to what is the deformation, what are the kinds of changes which are happening on the skin, human surface. Now we have talked about these different imaging techniques, and as probably one can very well imagine that the physics plays a significant role in understanding the principles correctly and operating the kind of devices in the safe regions. In addition to that, there are different electronic say components or electronic systems, subsystems, which help in say safe operation, as well as making them user friendly. Means for the doctors, say for example, if they want to see a particular thing, then for that purpose, the imaging devices which are there, the one thing is the kind of radiation source and the detectors, but further to that, the image forming is done on some kind of screen, and the things which are related to the screen or manipulation of the screen, maybe increasing the zoom, increasing the size, and thereby looking at the details, or say comparing it with references. So such all different things, they are possible with the help of the electronic subsystems which are provided. So that is essentially the part or role played by the bioelectronics. In addition to that, the bioelectronics has a significant role in terms of what is called as biomedical signal processing. Various kinds of signals which are generated by the different systems which are present in the human body, and these systems, they essentially produce signals based on a physical quantity which varies as function of some independent variable. Biomedical signals are obtained from a biological system by originating from the physiological process, and these signals, they help in providing some insight into what is happening. So one of the most common things is the ECG, electrocardiogram. As we know that the operation of the heart is governed by some kind of electrical generator which is present inside. So this electrical generator creates continuously stimulus, and this stimulus essentially allows the heart muscles to contract and expand. So this contraction and expansion governed by the electrical pulses which are generated, potential which is generated internally. So this essentially is the reason for the functioning of the heart. One can pick up these signals from the human body, and it has been observed over the years, several centuries, that these signals, when they are picked up, they follow certain characteristics. Looking at those signals, one can understand what are the health related issues related to the heart, whether the heart is functioning properly, whether various parts of the heart, they are in the normal operation, or whether there are any abnormalities. If there is some kind of reduced blood flow in certain part, or if the muscles are weak in certain part, these all can be diagnosed by looking at the electrical signals which are picked up from the body. So these electrical signals, they are picked up by means of having some kind of electrodes fixed on the body at different specified position, and then picking these signals up. Say one can have some kind of biomedical signal analysis by means of having the electrodes associated on the body, attached to the body, and these electrodes, they pick up the biomedical signals. There is electronic circuitry related to isolation, amplification or pre-amplification, then amplifiers and filters. Then there is some kind of analog to digital converter, filtering for removal of artifacts, detection of events and components, analysis of the events and waves, feature extraction, pattern recognition, classification, and then based on that, diagnostic decision. So one can have a diagnosis, computer-aided diagnostics, and from this diagnosis, maybe some kind of therapy related advisories, they can be generated. So this is the biomedical signal processing. Now this, as I said, that it is related not just to the electrocardiogram, but we know that there are various other biopotentials which are part of the human body, normal functioning of the human body. So for example, we say that we have the muscles, and all the movements what we perform, they are based on the movements of the muscles. Muscles expand, they contract, they are naturally under the command of the brain. So muscle expansion, contraction, this is generated by some, again, biopotential, and one can pick up that biopotential from the muscle activity, and this potential can be then analyzed as what we call as the electromyogram. We have the eyes And eyes, they again have a lot of muscles which are playing different role of focusing, of operating the cornea and having the image formed on the retina, then transferring the image to the brain through the optic nerve. So these are all different things which are happening. Now, again, there can be various potentials which can be picked up. That is basically based on what kind of stimulus is received by the eye, and one can understand whether the eye is responding to those different signals in most possible or most proper way. So this essentially is done by electro oscillogram, EOG. Similarly, the activities of the brain can be diagnosed, analyzed by what is called as EEG, electroencephalogram. Now, this electroencephalogram is generated by means of different electrodes. There are 20 electrode systems as well as 40 electrode systems which are put on different parts of the skull. It is definitely non-invasive, but at the same time, it is put in contact with the skin. So maybe because of the contact with the skin, there could be some kind of allergies that one has to be careful about that. But otherwise, other functioning of the body is not affected by these different kinds of biomedical signal pickups. So these are, say, 20 or 40 electrodes. They are put on the skull, and from there, the variations are recorded. And from those variations recorded, then there is a rigorous analysis done, and from the analysis one understands how the brain is functioning. It could be a passive observation of the brain, because even if you are not doing anything, sitting quietly or sleeping, the brain is still functional. Brain has to work on various things which are related to your body functions. Brain is the one which is responsible for the different systems which are present: the skeletal system, the muscular system, the respiratory system, the cardiovascular system. So these are all different systems. They are governed by the brain, and there are several say sensing mechanisms which are active. We know that we have 5 senses. All the 5 senses, whatsoever they pick up, that signal is communicated to the brain through the nervous system, various neurons which are there in the part of the body. So they accumulate that information, communicate it to the brain. Various parts of the brain function on them. They process and then come out with certain decisions. Some decisions could be related to identification, some decisions could be related to warning, some decisions could be related to generating certain actions and so on. So these different functions the brain is continuously performing. One can diagnose whether the brain function is appropriate, whether it is having the functionality which is as a normal person, or it is there are certain abnormalities. Then that essentially can be diagnosed by means of what is called as the EEG analysis. So we have different biomedical signals which are processed. These days, with the help of the computers and computer softwares, it has become relatively simple to analyze. But in the old times, there used to be physical records created, and from the graphs or the plots which are created, the doctors trained for that purpose, they used to essentially do the analysis by manual working. Whereas these days, with the help of the computers and availability of the different software tools, it has become simple. When doctor gets directly the implication or even along with the advisories. So one can have several such signals. Say the top signal is a ECG signal. Then we have the EEG signal. Again, under EEG signal, some kind of different potentials related to the eyes and so on. So one can essentially see such kind of multiple traces and one can analyze. Say, for example, looking at the EEG, one can relate it to different mental activities. Say, when one is thinking, not doing anything, but just thinking, say, there could be 2 different states when you are quiet. One is you are thinking actively on something, and when you are just resting. So if you are resting, you can see things are happening in this fashion, whereas when you are in the deep thought, the EEG signal can be of this type. When you are feeling drowsy, you can see that sometimes there is a very slow, low frequency activity, whereas some other times it is high frequency activity. When you are sleeping, the activity, you can see that has become slowed down. And when it is in deep sleep, there is some other thing. So one essentially gets such kind of differentiations based on the analysis of the EEG signals, and one can essentially use this for creating some kind of databases of normal persons, and then of course having some kind of abnormalities considered, and then comparing them, one can find out what essentially is happening to the person. So we have different acquisition and processing systems which are there. So they can be used for a priori desired information, interpreting the nature of physiological process based on either observation of the signal or observing how the process alters the characteristics of the signal, etc. So one can essentially see that we can have the electric potential, we can detect different events means the spikes which are happening in that. Then there could be artifacts which could be there. So when you are trying to pick up some signal, maybe there is some movement that is happening, maybe voluntary or involuntary movement that is happening. And this movement essentially can alter the quality of the signal. Maybe there could be some kind of spikes generated which are not related to the original process. So that is called as the artifact. So artifacts, they have to be removed. Then we have the heart rate analysis. So we know that these days we have different kinds of devices which are worn on the body. That is called as the body electronics. And this body electronic or wearable electronics, essentially a kind of wristwatch kind of a thing, or some kind of wristband one can put in, and one can have different heart rates or various other parameters measured directly. So when you are wearing such kind of band, and if you are say having different kinds of variations observed, one can actually diagnose what is happening. We know that many a times such kind of signal analysis is done for the patients who are in the ICU, because we know that in the ICU, the patient's condition is really serious. Many of the systems which are supposed to be normally functioning, they are not functioning, or they are heavily affected. And as a result, one requires the monitors which have multiple parameters displayed on them, acquired on them, so that one knows that, okay, whether the patient is improving in the health status, or whether there is some kind of degradation in the health status, so that maybe some alteration in the actual treatment, whether it is required or the treatment is going on in the right direction. So one can have such kinds of things. One can have different kinds of, say, attachments to the human body, and from the attachments, one can have the signals analyzed properly, and one can get information. In fact, these days, with involvement of different electronics tools and techniques, it has been possible that one can have different gadgets which one can carry. There are pendants which are worn on the human body. There are different kinds of diagnostics which can be performed. So one performs the analysis of heart rate, one performs the analysis of the ECG, one performs the analysis of the blood pressure, and one probably provides a kind of early warning related to some kind of heart attack or something like that. So one can use various signal processing methods using the signal modeling, wavelet and wavelet transform and filter banks, principal component analysis, independent component analysis, etc. Some clustering tools. So these are all different things which are tools and techniques which are tried, and one essentially carries out the classification related to the technology or related to the source or related to the application. So one can carry out the classification and one can put it in the records, one can store it with the help of now electronics memories. It has become possible to store huge amounts of records without much of problem, and one can recall and one can essentially look at how the evolution of a particular record is happening. So the patient's history can be very easily traced back, and one can really look at how best one can be treated. So biomedical applications for the signal processing, they would be related to information gathering, related to diagnosis, and continuous monitoring. Diagnosis is basically analyzing and finding out whether a particular element is there, and monitoring is essentially, as I said, in the ICUs, when the patients are being treated, their health status is continuously monitored. The monitored data is stored, or it can be communicated to the doctors if required in case of emergencies. So one can see the essential block diagram of the biomedical signal acquisition and processing system. A transducer or a sensor, amplifier, some kind of filters, analog digital converters, and then there is a processing that is done. This is something what is happening. One can find out the respiration. Say when there is a respiration, that gives some kind of spikes like this, or some heart rate. So one can find out the heart rate and the heartbeats one can identify. In fact, many times it is diagnosed that certain heart rate reduction is because of the weakening of the electrical resource that is being provided to the heart. So in that case, the corrective measure is that there is a pacemaker attached on the human body. So the pacemaker is essentially something which is trying to synchronize the functioning of the heart. It triggers the heart at certain specific intervals. So we have such kinds of tools and techniques which have been developed. Naturally, the development is not unitary. It's not that somebody has got the materials, or somebody knows the phenomena, or somebody knows the instrumentation, or somebody can develop it independently. It is multifaceted. It has to come from the doctors, it has to come from the material scientists, it has to come from the instrument makers, it has to come from the machinists. So all different disciplines, they come together and they come up with the tools and techniques available for the diagnostics, treatment, and monitoring. One essentially can see that the signal processing can be multidimensional. There can be different analysis tools related to spectral analysis, signal modeling, adaptive signal processing. So these are all different things which are possible, and it is evolving over the period. Say, for example, the early stages of corona, we saw that certain techniques were developed, especially for analyzing the person's voice. So looking at the voice, or looking at the kind of vibrations which are produced by the cord, so one could diagnose that, oh, there is some deformation happening over there. For the corona, there were early diagnostics which were related to the blood test, the swab test from the nose as well as from the throat. And in addition to that, there were several other non-invasive techniques which were used. One of them was extensive use of the X-rays, because the corona used to develop some kind of say patches in the lungs, and the X-rays they could be used for identifying those patches from the lungs. So one of our startups in our SPPU Research Park Foundation, and they have developed the technique of using the startup is Deep Tech. That's a startup based from Japan, and it has filed several patents. One of the patents is related to this particular development. So there is a AI used in the overall process, artificial intelligence used in the overall process, and from that early prediction of the acquisition of the corona has been possible, and they have developed that technique and they have used it. Uh, the team actually involved physicists, the AI experts, doctors. So they all work together, and as a result of working together in a team, they could develop with this particular product, and they are commercializing that product as well. So it's a very interesting thing. In addition to that, earlier I mentioned about the lasers. So laser stands for light amplification by stimulated emission of radiation. We know that the atoms have a certain structure. They have the electrons and neutrons, electrons and nucleus, and there is a possibility that if the electrons are in the higher energy state, they can fall to the lower energy state, either forcefully or by stimulation or spontaneously. So there are possibilities that one is spontaneous emission and the other is stimulated emission. Spontaneous emission creates some kind of radiation, some energy release, and this energy release could be in the form of light or photon. But this is uncorrelated totally. So this is the emitted photons we have no coherent. It varies in phase. Whereas the simulated emission, one can see that when there is an incoming photon, that incoming photon stimulates this electron to fall down to the ground state or the lower energy state, and thereby generating one more photon. This photon is exactly of the same wavelength or same frequency, and it is having a phase relationship. So this is what the stimulated emission is. So this stimulated emission essentially is, if it is extended further with a condition of population inversion, then it gives rise to a continuous oscillatory phase, and this continuous oscillatory phase essentially gives a laser source. So this laser source is a collimated beam, and this collimated laser source that can be used for different purposes. There are, according to wavelength, they can be classified as IR lasers, visible lasers, UV lasers, and so on. So the laser parameters could be wavelength, output power, average power, intensity, doses, and they are used for different applications. Say applications like mechanical, cutting application, building applications, communication applications. Laser printers are quite well known. But what is more important is the laser which is used in medicine. So lasers are used in medicine for different purposes. The type of lasers used in medicine, medical applications, they are CO2 laser, Nd:YAG laser, argon ion laser, and dye laser. Now these are used for the purpose of diagnosis as well as for treatment, therapy. Say for example, lasers are used in beauty therapy, and these lasers essentially they can be used for skin rejuvenation. So basically you can see that the wrinkles here, because of the laser treatment, these wrinkles have been removed and the person looks little more younger. Or here there are hair removed with a laser, or some kind of say stains which are there part of the face, which probably create some kind of say hiding feeling for the person. Now these stains are removed. Even these days there is a fashion of tattoos, and the tattoos can be removed by the laser treatment. The laser treatment is used for various other purposes, but what is more important is lasers are used in ophthalmology. The functioning of the eye is very important for any person, and there could be say diagnosis required. So we know that the retina has got number of blood vessels, and these blood vessels, they essentially are one of the bio markers, or one can say uh, like a fingerprint. This is one of the biometric uh, measures of identity of the individuals. There is a unique pattern of blood vessels which is seen on the retina, and through the fundoscope, actually the image can be taken, and one can, we know already for the Aadhaar purpose, say for example, we have the Aadhaar, and then the fingerprints are taken. In addition to that, the retinal image is also taken. This is the blood vessel pattern that is taken. Now, these are blood vessels. If there is a clot in these blood vessels, or if there is a damage to the blood vessels, then there could be loss of vision, partly. Maybe because of some diseases like retinitis pigmentosa, RP, which is triggered by diabetes. So there is a limitation of the vision of the individuals. And this again can be diagnosed. So one can essentially look at the lasers for the fluorescence spectroscopy, scanning for the ophthalmoscopy, or laser interferometry. So one can even have fundus fluorescent angiography. Angiography is not just related to the heart. This, I think, we should be quite aware. Heart functioning is, of course, understood by the angiography, but similarly, the fundusing angiography is actually working on identifying how the eye is functioning, the retina is functioning. Because primary organ in the eye, which is responsible for the image formation and which is responsible for communication with the brain, is the retina. So the retina has to be proper. The other parts of the eye, of course, they are there for the image formation. Means the lens and pupil, they are essentially responsible for formation of the image, and then we can get the image formed on the retina. So this retina, whether it is appropriate, whether it is functioning, whether it is infected, whether it is having some kind of hemorrhage or some kind of damage because of the heating of it, mechanical damage or any other such kinds of things, that they can be very easily diagnosed by what is called as fluorescent fundus fluorescent angiography. So they can be used for uh, various kinds of treatments, treatment of glaucoma, retina tearing, or diabetic retinopathy. So these are the specific diseases, these are specific ailments related to the eye, very serious ones. So if it is a glaucoma, is because of the excessive say pressure that is created inside. So there could be problem. So argon laser is focused externally on the iris to make incision and creating drainage holes for excess aqueous tumors to release pressure. Retina tear. So if there is a tearing of the retina because of some say excessive strain which has been created, mechanical strain, then the photocoagulation burn to repair retina tear due to trauma to the head. Because of the head injury, this can happen. Diabetic retinopathy, as I said earlier, so the field of vision is limited, and in fact, people lose their vision mostly during this phase. So there has to be some kind of treatment for that, and that is provided by the lasers. So if you just look at the eye, then we find that there is a retina on the rear part of the eye, and there is optic nerve, which is connected to the brain. And this essentially retina is having this eyeball, one can see. This is filled with some kind of fluid. Then there is a iris, there is lens, there is a pupil, and there is a cornea. So this they have a specific role, and then the light coming from outside that enters and focuses at the focal point. If there is a proper focus, then we see a clear, nice image. If the focus is disturbed, that happens in many vision-related deformities, then one has to carry out some kind of correction also. Say, for example, there could be different kinds of vision problems. One is the problems related to the focusing. So nearsightedness, nearby objects can be seen perfectly while objects at distance appear blurred. Light rays occur in the front of the retina. So they essentially focus in the front, and on the retina they are seen to be blurred. Or there could be opposite, acropia. So this essentially is a farsightedness. That is, the distance objects can be seen clearly, but the nearby objects, they appear to be blurred. Or astigmatism. So multiple images, they can be really seen here. There could be presbyopia. This is old age related problem, and there are different kinds of effects one can see. One loses the flexibility of lenses, and thereby the ability to focus on certain objects, that is lost. So maybe some objects, they can be seen clearly, but the other objects are very blurred, and then one has to be very wary of seeing the things. So there are non-surgical corrections for this using glasses, contact lenses, or orthokeratology, or one can go for LASIK surgery. LASIK surgery is essentially based on laser assisted in situ keratomyolysis. So this is LASIK. This essentially works on one can look at what happens. The cornea is inflated, and because of that there is a problem. So what do? They essentially remove the corneal flap, and then some portion is removed by the laser. So you can see earlier it was all budged, now it has been flattened. As a result, there is a correction in the eyesight. So this correction is almost permanent, because this has been removed and it has been flattened. So the correction is there. Naturally, it has to be done under expert supervision, and very sophisticated tools are required for this purpose. But this is possible with today's technology. Similarly, we have the dental lasers who carry out some kind of dental treatments. The dental cancer can be removed, or even the teeth whitening can be done. So you can essentially make use of certain tools, and then you can go for say laser based bleaching. So basically we need to understand that the overall process of laser based treatments is based on the absorption of photons, some kind of bond breaking, and some kind of ablation of the products, that is removal of the products. So this is used at many other places. Say, for example, after diagnosis, if one finds that a particular vein in a heart is having some problem, angiography one can carry out, and then one can essentially find out that, oh, there is a narrowing of the artery. So one can make use of the laser for treating this, removing the plaque which has been gathered, and then one can clear the pathway. Similarly, at different places, even the urinary tract, if there are urine stones, then they can be directly heated by the laser, and the ablation can take place, the breaking of the urine stones that can happen, and then they would be removed subsequently by the medicinal treatment. So likewise, you have lots of things. The medical physics is essentially a very wide and very vibrant kind of subject. Basic physics understanding is important here, but further to that, just understanding the principles is not enough. Adopting it into a technological form and making it suitable for the medical applications is more important. So I think I've tried to cover certain aspects related to the medical physics. If you have any questions, I'll be glad to answer. Yes, if there are any questions, please.
Any questions?
Session is open for questions and answer. Please, if anyone having questions, please ask. Student present in KIMS-DU, the students which are present online mode, if you have any questions, please ask. You can put in chat box also.
The questions, if there are questions, your doubts.
Anyone having question, please ask.
Yes. There is one question.
Yes. मराठीत विचारलं तरी चालेल, सरांना पण मराठी येतं, काही प्रॉब्लेम नाही. यू कॅन आस्क इन मराठी. तू विचारू शकता तुम्ही मराठीमध्ये.
हॅलो सर, आवाज येतोय का?
हो, येतोय, बोला.
सर, जेव्हा किडनी स्टोनचं ब्रेकडाऊन होतं तेव्हा तो रे पास केला जातो, तो हार्मफुल असतो का, काय कसं?
कुठला रे?
सर, किडनी स्टोन जेव्हा ब्रेक करायचा असतो तेव्हा किडनी स्टोन ब्रेक डाऊन करताना सपोज लेझर पास केला किंवा दुसऱ्या कुठल्या टेक्निकने रेज पास करून जर किडनी स्टोन ब्रेक केला तर तो हार्मफुल असेल का बॉडीसाठी किंवा नाही?
तो तसा बॉडीसाठी हार्मफुल नसतो. त्याचं कारण म्हणजे तिथले जे काही टेक्निशियन ऑपरेट करणारे जे असतात ते डॉक्टर्स एक्सपिरियन्स्ड असतात आणि ते एक्झॅक्टली जिथे कुठे ट्रीट करायचं आहे तिथेच ते हिट करतात आणि तिथलं किडनी स्टोन डिझॉल्व्ह केला जातो. तर त्यामुळे त्याचा काही ह्युमन बॉडीला इतर टिश्यूवर काही परिणाम होत नाही. जर तिथे तो ऑपरेट करणारे जे कोणी एक्सपर्ट असतील ते जर त्यांच्याकडे एक्सपिरियन्स तेवढा नसेल तर कदाचित थोडासा त्रास होऊ शकतो.
बट सर, स्टोन ब्रेक होतो तर मग स्किन पण ब्रेक होत असेलच ना, थोड्याफार टिश्यूज डॅमेज होत असतील?
नाही होत.
स्पेस असतो.
बेसिकली काय केलं जातं की तिथे ही जी सर्जरी असते ती लॅप्रोस्कोपिक सर्जरी असते. टू द पॉइंट, म्हणजे जिथे जायचं आहे तिथपर्यंत तुम्हाला छोट्या निडल मधनं ते घेऊन जातात, तो जो काही फायबर असतो तो, आणि तिथे ती ट्रीटमेंट केली जाते.
सर, फायबर टाकला जातो का फक्त लेझर?
नाही, फायबरच्या थ्रू लेझर जातो.
ओके सर, थँक्यू सर.
Questions?
अजून कोणाला क्वेश्चन्स आहेत? So
Okay,
shall
madam.
we, sir, I think there are no more questions. Shall we conclude, sir?
Yeah, sure, please.
I take this occurrence to thank the entire committee of KIMS TU as well as CMED Pune and the audience for the whole made this webinar successful. And I must remark a proficient sense of gratefulness to Dr. Shaligram sir, who has gave a vital time from his busy schedule. Thank you, sir. Thank you so much, sir.
Thank you.